Hello everyone. So we are moving from second trimester to third trimester. Third trimester is the time after 28 weeks of pregnancy, which means your 7th, 8th and 9th month of the pregnancy. So let's talk about few important changes and concerns during the third trimester. So as it is obvious, the baby bump is more visible now, you look more like a mommy. So how does it affect you? So as the baby bump is growing, simultaneously you may notice a change in the back posture, which makes you more prone to back pain. So how to deal that? 2 hours of rest during daytime and at least 8 hours of rest during night time is what is recommended. Second important change that you may feel is that early satiety, which means initially if you were able to eat 2 or 3 chapatis, now even after taking half or 1 chapati, you may feel full. So what can you do for this? Keep your breakfast and your lunch as the heavier meal of the day and keep the dinner as the lightest meal. And second thing, don't eat dinner and go to sleep immediately, or don't drink anything, a cup of milk or shake and go to sleep immediately. Keep a difference of at least 1.5 to 2 hours between your last meal and sleep. Third thing is that you may start noticing Braxton-Hicks contraction. This is what we call it medically. So you may start feeling some contractions which are not associated with pain. They are simple hardening of the uterus. You may feel that your uterus is hard, but it is usually not associated with any pain or discharge. So these are normal. These are kind of a false pain and they are known as Braxton-Hicks contraction. Now let's talk about concerns. What are the few important concerns in third trimester of the pregnancy? One and most important is baby's movement. Always remember that this is the most important thing that you should keep in mind. You cannot go to your doctor every day. You cannot get an ultrasound every day. So it is the mother only who knows that the baby is doing well in the womb, and that is in the form of baby's movement. So if you feel any decrease in baby's movement or absent baby's movement, please rush to your doctor immediately. How to count your baby's movement? After you had your lunch or a meal, just lie on the left side and see that your baby is moving at least 10 times in an hour when you have taken a rest for 1 hour in lateral position, left lateral position. So movements or flickers less than 10 is alarming. Go and report to your doctor. Next important sign in the third trimester is if you feel excessive cough or difficulty in breathing, especially around 8th month, around your 34 weeks. And the ladies who are carrying a twin baby or who have a high blood pressure should be more concerned about these symptoms. Wet cough, difficulty in breathing, swelling over hands and feet, blurring of vision. These are warning signs. Please report to your doctor. Third thing, any form of thin watery discharge or bleeding or sudden severe pain in your tummy is a warning sign. Kindly go and meet your doctor. So just be focused. When you are in the third trimester, you are almost there to deliver your baby. So just keep in mind these changes and concerns and stay healthy. I wish you all happy birthing. Take care.